In an integrative approach, the behavioral dimension is one of the three that I think is extremely important to look at. The behavior therapist would say it's not enough to have insights without translating those insights into action, which means now that you know this about yourself, what are you going to do differently by the way you behave? In the behavioral approach, assessment and treatment are seen as simultaneous processes. And I like about the behavioral approaches that assessment is given a central role. So the client and the counselor together are assessing and looking at what the problem is, what contributes to the problem, and what might we need to do to make the changes that are desired. And the question is asked very often in behavioral approaches, is this helping? So you're asked as a client to evaluate what we're doing in the office. Is it useful to you? So there's a sense of accountability, and I find that very valuable from this approach. One of the things that I particularly like about the behavioral approaches is they offer a very wide range of specific techniques that can be used for various problems. One of these techniques is desensitization. So clients can learn how to conquer some of their phobias with this. Relaxation techniques are something that behavioral therapists often use. Another is modeling. I think therapists can model specific behaviors for clients. For example, in assertion training, a client may have trouble in saying what he or she wants to say directly and forcefully, so the therapist might say, let me try it out and see what you think about this way, and can actually model it rather than just talk about it. I think another area here is self-management programs. So clients who say, I really want to get on with an exercise program. The behavior therapist has some strategies to help the individual keep track of their exercise and to manage reinforcement so that they stick with their program. So from an integrative perspective, I think the behavioral approaches offer a lot of concrete techniques that we can use when appropriate, given different problems that clients present to us. One technique that can be useful in reality therapy, at least that I find useful, is a technique called the WDEP system that really Robert Wobbleding, who's a reality therapist, invented. And W stands for wants. What are the client's wants, needs, and perceptions? D stands for what are you doing and the direction that your behavior is taking you. I'm not liking what I'm doing. The direction I'm going is not satisfying to me. That leads to step 3, which is E, or evaluation. So in that step, the client evaluates, is what I'm doing helping or hindering me? If it's not working, how could I change it? And step 4 is P, or planning. Once I make a decision I want to change, then the reality therapist actually works to specifically bring about change.
A behavioral focus becomes the theme in Dr. Corey's next session with Ruth.
So last week, Ruth, I remember the session being pretty emotional for you.
It was kind of hard for me to come back tonight. I was worried about what it would be like to be with you again after you kind of seeing that vulnerable part of me.
And how is it for you to tell me that now?
There was some relief in it, besides the embarrassment. And I remember when I was journaling that I wrote down about, my embarrassment of you seeing me that way, but also that I had felt relieved and I felt better.
Because their prior session together was an emotional one, Dr. Corey and Ruth reflect on how this affected them. Such transitions can be an important part of therapy.
Well, one thing that I wrote in my journal after that session was that even though it's really sad that there's a lot of problems in my relationship with John, I realized that I'm going to go forward, that I really do want to change. And even if he doesn't want me to, It's something that I need to do for me.
Mm-hmm. So you're ready to kind of do things for yourself, irrespective if other people are going to go along with some of the things you may want to do.
Well, there's a couple things in particular that I thought I would, that I've really been wanting to do, but I haven't kind of have the motivation. And remember, not long ago when we were setting goals, we talked about my weight. And I think that's something that I'd like to try and start to work on.
Ruth is now ready to work on making changes in her life. Dr. Corey's role is to help her identify and focus on the behaviors involved.
Do you have any kind of idea of what you'd want to do that?
Well, I think one of the problems is that I really don't get much exercise. And I know I'm really, like, I get out of breath when I walk upstairs, and I'm really, I don't have much energy.
Like what for you would be something you'd want to do?
Well,
do you want to exercise, first of all?
Yeah, I do.
You do?
Because I want to feel better. I want to feel healthier.
Helping clients explore their options and make changes in their everyday lives is central to the behavioral focus.
If walking is pleasurable, then by all means do that. But there are a whole range of other things you could do too. Swimming, playing tennis, jogging.
Well, I think I'd start with the walking. I'd be more comfortable with the walking.
And how long would you walk?
About 20 minutes.
Together, they develop a detailed behavioral plan that Ruth can work with.
One of them is you're going to walk 4 times a week, at least 20 minutes each time. And you're going to write down what you eat and when, and keep a monitor. You're going to monitor that. And I think it might help if you could somehow be accountable to somebody. Do you have any friend, anybody in class that you'd be willing to contact and tell them how you're doing on these? And what I was drawing on here is largely a behavioral focus of it's important to do something if you want to change. And what we were trying to work on more was to predict barriers that would get in her way so that she could, when those obstacles came, that she could do something about getting through them. And I think what was important is to get her focused on something that she wanted, like walking. It was much less important what, but something she wanted to do and carry forth with it. And secondarily, I think it was important that she find some kind of outside support system. So Susan, her friend, would be very helpful here in terms of helping her when she gets down or doesn't follow through with her plan. Well, really, there are a number of theories, I think, that naturally lend themselves towards integration. The Adlerian approach is a holistic approach. The rational emotive behavior therapy approach stresses interaction of thinking and feeling and behaving. Cognitive therapy is sometimes said to be a truly integrative approach, which it is, because it does deal with cognition and behavior, and it makes room for emotion. Gestalt, I think, is a theory that very much lends itself to integration. The Gestalt therapist is interested in awareness, and that includes awareness of your body, awareness of your feelings, awareness of what thoughts are going on. The Adlerian approach is a very holistic therapy, and in many respects it lends itself very nicely to integration. Adlerians talk about the past, the present, and the future as being intertwined. So some therapies say, let's explore and understand the past. The Adlerians say, that's important, but what's really important is to understand where is the client moving toward, what are the future goals that are impelling the person. The Adlerian approach really says you can only understand the individual by understanding all the various parts of that individual. And including, Adlerians talk a lot about meaning in life and purpose. I think spirituality fits in here, that for many clients their struggles are more universal, and their struggle is to find meaning, a quest for living. I think that fits. Adlerians also talk about what they call social interest. And the Adlerians would say, unless the client is somehow looking for broader things beyond self-enhancement, that they're not really satisfied. So Adlerians say we have a need to contribute towards making the world a better place. Technical eclecticism is a term that Arnold Lazarus, the father of clinical behavior therapy, talks about. And again, to be technically eclectic means that you draw upon many different techniques from many different schools of therapy without necessarily adhering to or endorsing the theory that spawned that technique. But what he very much endorses is taking techniques from the various approaches and tailor-making them to a client's individual struggle, always fitting the technique to the particular client. Technically eclectic, you really have a basis for drawing upon a wide range of techniques that you can use with the same client at different times. Family systems approach would basically say you can't fully understand the individual without understanding the context, the family system, that the way we behave individually has a lot to do with the system we came from. Adlerians talk about this. They talk about family constellation, your birth order. I believe that. I think that one's family of origin is extremely important in helping us understand who we are and how we behave in the world. Furthermore, I agree with the family therapists who say that we need to go back 3 generations really to understand baggage that we sometimes drag along into current relationships. So I think an integrated perspective would certainly make room to understand and talk about your place in your family, and even having some sessions with family members to help the individual understand him or herself better.
In this next session, Dr. Corey focuses on how thoughts, emotions, and behavior work together.
It's really starting to bother me. I'm having that feeling like my chest is pounding and feeling kind of dizzy again. And just since last week, it's been bothering me again.
And what's been happening since last week?
Well, I've been thinking about this marriage thing, that we've been talking about in here, and I really want to find a way to talk to John about, participating more.
Mm-hmm.
It's been hard for me to try to take what I learn in here and go home and talk to him without getting really emotional or without getting into an argument or without feeling really hurt.
Since clients are thinking, feeling, and behaving individuals, integrative therapy looks at the whole person. Here, Dr. Corey starts with Ruth's thinking or cognitive process.
What do you think you are telling yourself when he turns you down? When he doesn't do what you always want? What do you think goes on inside of your head?
He doesn't love me anymore.
So you make that conclusion. You jump to the conclusion that if I don't always get what I want with John, then he doesn't love me.
Mm-hmm.
I'm not a good enough person?
Mm-hmm.
Could that be a part of it?
I'm not important.
Mm-hmm.
I'm not good enough. I'm not something missing in me. Otherwise, he wouldn't want to do this.
Mm-hmm.
I don't know if it makes sense.
So maybe what you could do is be aware that maybe your conclusion is faulty in some way.
Mm-hmm.
That if he turns you down or you don't get what you want, it may not be indicative that you're not worthy, that you're not lovable, and that there's something wrong with you.
Mm-hmm.
Maybe it's that he's scared. Or that
In addition to looking at Ruth's way of thinking, exploring her emotions is also necessary.
you said you're very emotional when you talk to him, and you're afraid you're going to cry, and that you feel hurt a lot. Is there more you want to do with that?
Dr. Corey and Ruth get involved in another behavioral role play where Ruth's thinking and feelings come to the surface.
You've cried. He's trying to reassure you. Be him. What would he say? And I'll be Ruth for a bit.
Well, there you go. Now, you're crying. Now, what did I do wrong?
You
You
know,
must have
John,
said something.
it's not that you did something wrong. It's just that sometimes I feel like there's not much hope. and I really want to go to this retreat with you.
But every time you cry, I just felt like I can't do anything right with you.
I know, but
You're so sensitive.
I want you to know it's not just you. There's a lot of things in my life with Jennifer and other people, my father.
Later in the session, Dr. Corey moves to a more behavioral emphasis with Ruth.
So maybe you could let them know when those feelings come up a bit more about what is going on with you and about the hurt. And if you feel you can't do that, maybe you could even talk to a tape recorder in private about what's going on with you. Maybe write in your journal about that. But before we leave, I'd like to talk about how you're going to go home and deal with John, because you did say you really want to approach him. So what kind of homework can you give yourself in this area?
Well, I think I'll commit to talking to him before next session
Okay.
about the marriage retreat.
What day do you think you'll pick?
What day? How about Tuesday?
Okay. Is that okay for you?
Yeah, I think that's a good day.
Clients are really an integrated whole that we can't neatly separate thinking from feeling from doing. And in one session, we really touched upon all the three different dimensions. First of all, Ruth had some thoughts that I think get in her way at times, and part of my technique was to get Ruth to identify what are those thoughts. The role-playing was designed to highlight some of that. There was also, on her part, getting in touch with some feelings of hurt and anxiety, and again, that flowed from talking about her thoughts. Then at the end of the session, I wanted her to think of a concrete plan of action, something she would do once she left here, setting her up for homework. And it was really important that she gets John to go on the retreat. So we rehearsed it in several different ways. And I felt she was very strong and staying with herself. So my main technique was to get her, when she feels like shutting down, to talk out loud. One theory that I think is most helpful in understanding transference and countertransference is the psychoanalytic approach. Regardless whether we have that in our theory or not, whether the theory accounts for transference, I think clients will bring in some of their issues and their feelings from significant others and project them onto us as counselors. I think we need to work with that therapeutically, and this model, psychoanalytic, does help us in understanding that.
Other clinicians share their perspectives on transference.
When you work with a variety of populations, you're going to have many different clients transfer feelings onto you from their past, and sometimes they're positive feelings, sometimes they're negative. And I think it is important for the therapist to be aware of the transference and to work with it and help the client work through it as much as the therapeutic process allows, but be aware that it does exist and be sensitive to it.
I've seen that happen with other clients when they become perhaps upset with me, or that if they're wanting me to transgress therapeutic boundaries and come into a more personal relationship with them. And that would be an example of perhaps them looking for my approval as a therapist beyond just the therapeutic relationship.
In this session, Dr. Corey finds that Ruth has some transference issues with her counselor.
Like, no matter how hard I try, that I can't please you. Like, I'm not working hard enough in here, or I'm not doing something right. Kind of reminds me of being with my father.
Transference is a client's unconscious projection onto the therapist of feelings or attitudes from previous relationships.
We were talking about my goals, or maybe it was more than a couple weeks ago. We were talking about my goals, and you said that I was being vague. Mm-hmm. And it's just, I felt like you were critical, like you're not understanding me. You're judging me. I can't please you. I'm never enough. Just like with my dad. You're just like him sometimes. I don't think you understand me.
With transference, clients may become emotionally distant or have feelings of attraction, anger, or resentment. As with resistance, some degree of this can be expected.
Okay, let me check something. How is it for you to have said all those things to me?
Well, I almost pictured my father's face when I was talking to you.
Mm-hmm. Say a little bit more about
I
that.
get confused. I don't know if I'm talking about him or if I'm talking about you. And I feel frustrated. It's like I can't get rid of those feelings that I've had when I've been with him, of him being way up there and me being way down here.
Mm-hmm.
And it feels like that over and over, even here in therapy. And there's this one part of me that says, no, Jerry doesn't really think that way about you, but I keep going back to that. I keep thinking
wondering.
That's what you must think. You must want me to be like you. You must be disappointed that I'm taking so long to be doing better.
Through exploring these feelings further, it becomes clear that Ruth is projecting unrealistic qualities onto Dr. Corey, a common form of transference.
Well, sometimes I feel angry with you when you say, you seem quiet, or you seem like something's going on, almost like I'm transparent and you can see right through me. Like, you know what's going on with me before I know what's going on with me. I don't even know what look I'm giving you, that you have some idea about how I am. And I feel angry about that. Like, I would like to know about me before you did. Like, I can't cover anything up and you already know. You know before me.
You know, it seems, Ruth, like you give me an awful lot of power. I don't think I have X-ray vision, and I don't see things in you that you don't tell me. As you're talking, I'm thinking there's not much room for me to kind of be who I am right now. You're telling me how I'm way up here, and I'm not going to approve of you, and you're never going to be perfect enough with me, and I don't know where to go with that. You're kind of telling me all the things I am, and not giving me much room to kind of be different with you.
Working with transference helps deepen the therapeutic relationship and gives clients insight into how their past affects current relationships.
As a counterpart to transference, when clients have feelings towards us, it frequently brings out some of our feelings about their reactions to us. So a client may be angry with us, and we may have issues about anger ourselves. So I think what's important is that you as a counselor are aware of your potential countertransference, a potential unresolved issues that might get in the way of your counseling a client effectively. I think that's a good rationale for therapists having their own therapy. So this model, I think, psychoanalytic would say, not only know your client, but know yourself and be attentive to your own reactions and work with them therapeutically.
For counselors, understanding countertransference involves understanding oneself.
I worked with families a lot, and I found that I was very critical of the parents in the way that they parented. And I learned that that's not very effective in helping them change. So my countertransference really was getting in the way. And to try and rescue the children out of these horrible situations is also not very productive, and that was, again, my own countertransference.
I was seeing a woman who had lost her daughter from a car accident. The daughter was riding her bike and got run over by a car, and it was very tragic, and she was coming in for grief work. And I really empathized with the client, and what made it very difficult for me is that the client's daughter was the same age that my daughter was. And after I would complete the session, it would really affect me. And what I found really helped is to have a colleague or a supervisor to share that with and to get my own support, because I felt like I was being effective for the client, but it was bringing up a lot of my own fears and issues. And so I know that getting the support really made a difference in me being able to continue effectively with that client.
That's the beauty of countertransference, is that I think it helps us as people to continue growing. And if we're willing to take a look at our feelings in reference to the people that we work with, then we're continually in a state of learning. And I would encourage people to go and get their own therapy, to be involved in their own groups, to talk with supervisors, those kinds of things, because I think that's essential.
Later in the session, Dr. Corey must address his own countertransference.
Maybe there is some part of you that you're putting onto me. Maybe some residual with your father I'm getting. But maybe there's another part of it. And that other part might be that sometimes I might not be as patient as I might be. And sometimes I might not acknowledge things you do.
Since counselors are human too, their own needs and personal conflicts can surface and affect the therapeutic relationship. This is called countertransference.
This is not easy for me to hear all of this. You know, sometimes I feel a little bit blamed, like somehow I'm not doing it right, or maybe I've been too short or judgmental.
Countertransference can take many forms. Being overly controlling, judgmental, sympathetic, or feeling attracted to a client are some examples. Here, Dr. Corey's need for success and approval comes out in the session.
You were saying sometimes you feel you're never enough. You can't do it right. And I think somehow you touch me with that personally. That sometimes I feel that no matter what I do, it's just not quite good enough. That it could always be better. Or if I didn't do what I did, and if I didn't produce, then I wouldn't be loved and accepted. So I think somehow I was tuning into that, and it was very easy to kind of feel with you on that. So, you know, I'm hearing you, but I want you to know I was very much with you in that it's not a struggle that's over with for me.
Like transference, these feelings should be acknowledged either in the session, if appropriate, or through the counselor's own therapy or supervision.
How was that to hear what I said?
Well, it really surprised me.
Surprised? What part surprised you?
Well, that you'd be so willing to tell me about yourself.
Uh-huh.
You'd be so willing to tell me that you struggled and...
Well, I try to push myself to talk to you about how you're affecting me in these sessions. You're right, I don't talk much about myself outside of the session, what my life is like out there, because this is your hour primarily. But I think you have every right to know how am I affected by sitting on the other chair.
Well, it really touched me, and it made me feel kind of sad, because that's exactly what I was wanting with John.
With the many feelings that can arise in therapy, objectivity can be a challenge, but by working through these feelings, new levels of trust and understanding can be gained.
So I want you to know that, you know, I don't always say the right thing. I'm not always as sensitive as I might be, and sometimes I might not acknowledge the work you've done. What's happening?
I just appreciate that. One of the fears is that you would just tell me all of this was about my father. When you're telling me it's not, sometimes it's about you too.
Mm-hmm.
I've never been able to trust that I could really perceive something, and that it wasn't something, somebody else would tell me that it was something other than how I sensed it. So you're telling me I'm not all wrong.
No, I don't think it's wrong and right. You know, and I think it may be mixed up. Maybe there's some father in me, and as I say, maybe there's some part in me that is sometimes impatient. To the extent that we haven't dealt with past unresolved issues, it's going to creep in and color our here and now interactions. And I think we saw some of that with Ruth, that she made me into the critical father, she made me into the idealized father, the idealized husband, and I think it's not enough just to say it's simply transference. Mixed in there is some real element that she's picking up reactions to me and responding to me in some ways too. The other part of that is countertransference, my own reactions to her that may be a bit extreme. And I think particularly when I'm being told, in this case by Ruth, how I am, that I'm being judgmental and critical and I'm aloof and I'm not doing it right, she gets to me. So by being, I hope, a bit patient in telling her how I was affected by that, I think that's grist for the mill and we can work with it. The other part about my own countertransference would have been on the piece of really kind of being touched by her own struggle about never being quite enough, fearing lack of approval. that's an old historical issue with me. And I don't think I have to be cured, but I definitely think that I need to monitor that and see how that might be playing out in a session. The past, I think, is an important dimension in counseling. There are some theories that don't pay much attention to that. For example, reality therapists say, let's focus on the present. The past is gone and done, and what good does it do to explore what's happened last year or when you were a child? Rational emotive behavior therapy doesn't pay a whole lot of mind to one's past. Ellis would say, why waste time whining about what your mother never gave you? Let's worry about your thinking today and change that. But I think that you really need to revisit the past to see how our past sometimes gets in the way of here and now functioning. So while I don't favor getting lost in the past or dwelling on the past, I certainly think it's important to understand how our past plays out important roles today in our interactions with people. What I particularly like is Gestalt therapy's way of working with the past. The Gestalt therapist will say, when something becomes evident that there's some unfinished business, let's act it out in the here and now. And almost inevitably, if you stay focused on the here and now, if there's a past issue, it'll show up in the present.
In this next session, Dr. Corey and Ruth try to understand how the past influences the present.
I wanted to tell you that I had talked to John about the idea of going on the marriage retreat.
Yeah, how did that
and
go?
I was surprised he agreed to go. At first he didn't, he wasn't real, excited about the idea. But he did listen to me. He heard me and he heard how important it was. And he was a little concerned about going himself. He didn't know what was going to be expected of him. But he did agree to go. So I just shared with him how important it was to me.
Ruth has been successful in communicating her needs to her husband. However, their plans for attending a religious retreat together brings up a new issue.
This last week, I've been thinking a lot about my past and kind of anticipating going to this church weekend. I was thinking a lot about how I grew up in the church. My father being a minister and everything, and how much that's influenced me.
Since we all have a history and are influenced by our past, exploring developmental experiences as a basis for understanding current issues can be useful.
There's one particular incident that I remember that keeps kind of coming back to me, and I keep going over and over it again. And it's kind of hard for me to talk to you about it.
So are you willing to take that chance?
I feel like I need to talk about it. There was a neighborhood kid that I played with a lot, and he was a boy that lived a couple doors down from us. Well, we were playing, and he was the doctor, and at one point he took some of my clothes off, and all of a sudden my father found us, and he walked in, and he yelled at me and he said, "Ruth, what are you doing?" And I was so ashamed. I knew that he was really disappointed in me. And I knew that he'd never feel the same.
Pretend I'm your father and I'm not going to say anything. And maybe if you could look at me and tell me, I just caught you, okay? And I want you to tell me what's going on inside of you.
To help Ruth explore her past, Dr. Corey uses role-playing and Gestalt techniques to bring the past into the present.
Oh, Dad, I'm sorry. I don't know why I let that happen. And I know you've always taught us never to do anything like that. Now I just don't know how I'll ever look at you again. I'm so embarrassed and ashamed. I don't know how you're feeling towards me, and I'm afraid you won't love me anymore.
Ruth is still deeply affected by some of her past, in particular, her rigid upbringing as a child.
Like I had done something so bad that he was never gonna love me again. He was never gonna talk to me. He was always gonna think of me as somebody that was bad and dirty and somebody that disappointed him and did exactly what I was taught not to do by the church.
Here, Ruth shows some emotion. Later, Dr. Corey suggests a role play.
Were you willing to try something with me? Maybe you can be the voice of your church, in your past, in your father, and give voice to that and talk to me, and I'll be another part, a more accepting part, the part that you say you'd like to hear.
Dr. Corey suggests that they switch roles.
So now you're just going to be doing whatever you feel like doing?
No, I didn't say that.
You don't have any values anymore?
Well, I do have values, but they're my own values, and they're not the values that you've been preaching.
Oh, I can tell that because you're not going to the church that you were raised in. You're going to that new
Because I have
liberal
I
church.
have a lot of trouble with that church I was raised in.
So now is this new church teaching you can do whatever you feel like?
No, the new church is teaching me, my new values are teaching me I'm a human being, I've got my faults, but I'm not bad. And even though I may do bad things at times, I'm not basically evil.
When you don't know how hard it is for me to have a daughter that doesn't come to my service anymore.
But you know, and for many years I tried to get your approval. And I think the only way I could get your approval would be if I would be the exact daughter you'd want. Scared, frightened, all those things. And I don't want to be that. So to get your approval costs too much. The price is way too high.
I sure wish I could talk to my father that way.
I want to comment that I think the past and the present are very much related, and I don't know how to separate them. But the main piece, my bias is that as much as possible, I would like the client to experience in the here and now what he or she is struggling with, rather than just telling me about it, which is very Gestalt-oriented. So I simply ask her to stop and to relive and re-experience what it must have been like to be 6 years old. And I think the value of this is she begins to feel this as well as just talk about it in an intellectual and a kind of removed way. Existential therapists tend to work with decisions by having us see our life almost as sort of a plan. There's a design, and existential therapists challenge us to make modifications, to redraw the blueprints, so to speak, that what was decided can be redecided. One of the things I appreciate about behavior therapy, reality therapy, and cognitive behavior therapy is the emphasis on going into the real world, in vivo, in real life, and practicing. So all of these approaches say, if you want to change, you have to go out in the real world and practice. Just like any skill, you have to practice it to get better at it. So a big part of therapy is not just having insights and acquiring knowledge about ourselves, but it's making decisions about how will I be different with significant others that I interact with. So these approaches basically say, go out and do something different. Be willing to experiment with new behavior to get an idea of how you want to be different in the world. So we have to translate our insights into concrete action plans if we hope to change.
In this session, Dr. Corey and Ruth focus on decision-making and behavior change.
I kind of carried with me the voices from his disapproval.
And when you think about the decisions that you made as a child, are you clear on maybe some of the decisions you did make? What you told yourself about your own worth?
I think I told myself that I was only good if I behaved the way that he wanted me to. That sexuality was bad and wrong.
Through therapy, Ruth has gained greater insight into her thoughts and decisions. Now she can begin to apply what she has learned.
What are some of the ways you're revising them? What are some new decisions you're at least approaching?
Well, once I told John about what had happened, he seemed to be more understanding about how that had affected the beginning of our marriage, and maybe even still how now sometimes it keeps me from feeling more free. And now I've been able to, having his understanding, be able to tell him a little bit about, how I'm feeling or, what I might be wanting. I feel like I can get close to him without feeling awkward and funny about it.
I remember when you first came in, I still have visions of that in terms of how much you doubted yourself and how you were so censored about everything you wanted to say.
Insight without action is only half the job of therapy. Making new decisions on emotional and cognitive levels, not just intellectually, is essential.
So that seems to be going along well. Oh, by the way, I got into that fitness class.
Yeah.
Remember I told you I was
I
going to
do.
enroll? It was really hard because it was full. And I went to see the instructor, and I told her, I know the enrollment is full, but it's really important to me, and I've been wanting to take this class. And she said she'd save a space for me and let me add the class.
Was that a little difficult for you to
It
do?
was. It was difficult. I was real nervous.
Uh-huh.
And the instructor could see that I was nervous.
Now, do you suppose there's a new decision operating here that leads you to do this, to go and talk to your instructor this way?
Well, maybe something like that I could express something that I want or that I need.
That I have a right to have some needs and to express them, even though you got a full class. And I may not get in, but I sure would like to.
I feel too like I'm telling myself that I don't have to give up all the time. But I could kind of try and fight for something and hang in there a little bit longer to see if it's possible. I'm not giving up so soon.
By putting into practice what she has learned in therapy, Ruth has found promising results and new confidence. Together they discuss the idea of termination and Ruth's continued growth.
Well,
So-
this has helped a lot.
Uh-huh.
Overall, I feel more confident in myself. In fact, I'm getting to the point where I'm wondering if I should try this on my own. I kind of I've thought about it for a while, and there's one part of me that says, oh, well, I wouldn't be able to do it without Jerry's support and encouragement. And then there's this other part that says, well, maybe I could. Maybe I could kind of hear his voice telling me that, maybe I'm not so bad after all. And I'm thinking about it.
I very much like the work you've been doing, and I don't see it as a cop-out. I don't think you're trying to get out of something. And what I would very much hope is that we meet next week and make next week our final session so we can review things. But what I would like to suggest is, could you set up a plan, now that you're going to finish here, of how you can use this as a beginning and go on to new things, like we've talked a
Well,
bit
you
about.
talked about that group.
Yeah.
I'm still pretty
How did you
nervous
know I was
about
gonna bring that up?
I knew you were going to bring that up.
To a large extent, I'm really drawing on cognitive, behavioral, and the experiential approaches, because I'm asking her to feel what those early decisions felt like, and to feel how she would like to behave differently, and feel differently, and also to begin to think about those decisions. So it's really a mixture of cognitive, behavioral, and experiential. And my main hope is not that she throws everything away that she learned, but that she revise her decisions and see what parts of her early learning that she wants to keep and what parts she may want to modify. It's interesting, too, that Ruth brings up the issue of termination, and I want to stress that I think therapy should be movement from the very first session towards termination. And yet, as you know, I'm trying to prepare her for how can we begin after termination, that you can continue your own program. So largely, I'm very much in here into action orientation. What have you learned in this being together that you can begin to apply in your life once we formally terminate? You know, counseling ought to be a terminal process. It shouldn't go on for a great deal of time forever. And I think clients need to be prepared for termination. It shouldn't be sudden. Also, I think talking about clients as collaborators, I think it's important for the client to initiate when he or she thinks they're ready to go on their own. Hopefully, they have at least 1 or 2 sessions at the end to deal with the ending. What did you learn here in counseling? What was helpful to you? How have you applied this in your everyday life? I think it's also important to predict future stumbling blocks or possible regression. And it might be helpful to leave the door open to the client too, that the client feels free to come back after a month or so and say, you know, let me tell you how I've been doing. Adlerian therapists talk about the stages, 4 stages in counseling process, and the final stage is called reorientation. So during the final stage of counseling, clients make new goals and new aims that they're going to be working towards. They also commit themselves to a plan that they'll be working towards. So in this particular approach, clients are translating what they've learned into new behaviors in their everyday life. In feminist therapy, the key is the client is empowered to make the decision of termination. But once therapy is ended, there's a real encouragement for the client to go out and engage in social action. In family therapy, the aim is to help clients figure out how they can be different in their families. It may be hard to get mother or father to change, but you could certainly encourage your individual client. How could you be different in relationship to your mother? How could you approach your father in a different sort of way, even though he may not change and she may not change? Evaluation, I mentioned earlier, is something that starts in the first session and really goes right to the very end. But I think when evaluation is particularly important is after a client has completed the therapy with an individual therapist, in terms of kind of looking at the process as a whole. What stood out for that client? What things were most helpful? What are the client's plans now that therapy is coming to an end? So the best way, I think, to evaluate is to ask the client, you know, what from your vantage point was really useful in our work together? How do you think that you can continue implementing in your life what you started to learn in here? I think what's crucial is to get the client to review what did you learn, how did you learn it, and what will you continue to do to apply what you learned in the office here to your everyday life. I think it's also a time to make further plans, very specific plans of what do you want to be able to say 1 year hence. And to say that, what will you have to do today, tomorrow, and next week? And lastly, I think it's important that clients have an opportunity to talk about their feelings, about separation, about ending the formal therapy relationship. And very importantly, that the client learns how to give him or herself recognition for what he or she did to bring about the changes. In other words, I think the client is the one that should be credited with the change. And I think that's very important to acknowledge.
In this final session, evaluation and termination become the central themes.
Well, I remember last week, one of the things we talked about was this would be your last formal session here. I'd like to find out how it was as you were coming here today, what you were thinking and feeling,
Well,
having said that.
there's kind of 2 parts to it. One was I was kind of excited, you know, kind of like graduating and kind of moving on to something on my own, and I was excited about that. But I realized as I was driving here that I feel sad. I'm gonna miss this. I'm gonna miss you, and it's gonna be hard, that part.
Ambivalent feelings about termination are common for clients. Ultimately, the decision is the client's choice.
Part of what I'm going to miss is, you know, having somebody really listen, and I feel like you heard me and I feel like you were okay with me, that you just let me be and find my way. And through that, I found that I could trust you. And I think this is the first time where I felt so comfortable talking about myself and trusting that what I told you, you weren't going to be judgmental or critical about.
For therapists, an important index of progress is the therapeutic relationship. If it has been one of trust and the client is dealing with difficult personal issues, then therapy is working.
I hope you'll see your part in that. I'm not going to say I didn't have a part in it, but I think you were the one that talked initially about what might get in your way of trusting me. You see that part?
Yeah, I do.
Because every time you said, I've got something I want to bring up, but I'm scared and I'm not sure how you're going to respond, that was opening the door to doing some hard work.
Dr. Corey and Ruth evaluate her progress, an assessment process which has continued from the first session to the last.
I think what was helpful was sometimes we spent a lot of time talking about my thoughts and where kind of they came from and how I might want to change them. And sometimes I think it was important for me to, you know, not think so much about thinking and to just feel. Like I know that it was helpful when you asked me what was going on for me at the moment, or what was it like for me to be with you, or to have done a certain thing when we were talking back and forth to each other as people in my family.
Through her experience with integrative counseling, Ruth has a new appreciation for herself as a thinking, feeling, and behaving individual.
But then also, it was hard for me to do what we practice in here on the outside. And I think if I hadn't had a place to practice and learn how to take what I'm learning here to the outside, I wouldn't be so encouraged to take this and use it with John and with Jennifer.
I think another thing you were saying in not so many words is that you learned a lot in here about yourself, but one of the key things was to take whatever insights you had and whatever awarenesses and begin to use them and practice them and do them.
While addressing the therapeutic relationship and the client's own perception of progress, the evaluation also looks at behavior change.
It's kind of, you know, new world out there for me. And I'm excited about, you know, some of the things that are going to be happening soon, you know, in terms of my graduating and becoming a teacher. I'm excited about how I think John and I are getting along. I think we're talking more and understanding each other more. So I was kind of excited to try things even more of what I've learned in here out there.
Termination is a process that we built up to. This is a number of sessions we started talking about this, and as you know, the last session I asked Ruth to think about and write, where did she want to go to beyond here? My main attempt, I think, was to bring closure without closing things down. So I wanted Ruth to look at what this has meant to her, what she's learned, how she's learned it, and what she will continue to do with what she's learned. How she can go into other forms of therapy, couples, family, group, those are options. But her own projects, things she can do on her own. And I did ask her to talk about what was most important to her, what was most helpful. And I think her discussion brought out that working with techniques from a cognitive perspective, a feeling perspective, and a behavioral perspective are all important. That at different phases in her therapy, she needed different emphases. Sometimes she needed to be more heady and to think about things and challenge her beliefs. Other times she just needed to feel her sadness and experience her aloneness and experience the beginnings of anger. And sometimes she needed to take what she was learning in here and begin to translate it into different kinds of action and different behaviors out in the real world. So I think you could see, looking at this last session, that Ruth valued, and by the way, I want to stress this, that Ruth is the expert. The client is the expert. What's important is to her to find her own words and to see that she can make sense of this process. And This is the beginning of a new journey, not the end. The question of how you can develop your own integrative approach to practice, I think, is number one, learn about a primary theory. Really get familiar with that theory, really live it. Do a great deal of reading about a theory. Then I think a second thing is to personalize the theory. Find a way that you can identify with that theory personally. Another is let yourself be your own client and ask yourself, how, if I were a therapist, would I use this theory in understanding and working with myself? Experiment with the theory in action. Be willing to practice with supervision. That's a key, supervision. When you're working in the field, be willing to bring in your cases and think about your theorizing. Attend workshops. That's so important. Go to a workshop that will give you some further training in the theory that you're interested in. And be willing to read a great deal about the theory, and really try to get into the frame of reference of that theory. I think practicing reflectively is important, to be thinking after a session. Why did I do what I did? What seemed to be helpful? And there you can again ask the client to be a collaborator. You can frequently say, what was helpful for you in this session? What seems to be working for you? I think the other is to be open to thinking about how you can borrow techniques from the many different approaches, that you don't get locked into one approach, but you find a way that you can really incorporate into your own style and find a way that you can adapt the particular theory to something that fits for the person that you are. Don't leave your style out of it. Don't leave who you are out of this equation.
For Ruth, this journey will have many challenges. But through integrative counseling, she has learned to explore her thoughts, feelings, and behavior, a process that has given her new tools and insights to help her along the way. Through her own growth, she can continue to enrich her life and the lives of those around her.